Hello.
Hello. Oh, God.
This episode.
I think this is healthcare.
Hello.
I'm everybody's favorite semi-pro singer, V. Koeck.
And I'm the winner of season 6 of TLC's I Didn't Know I Was Pregnant, Lucas Myers.
I'm the girl sitting in her room singing and crying to My Heart Will Go On, Maddie Hogue.
And I'm only here as a part of the Make-A-Wish Foundation, Maggie Staines.
Welcome to I Think This Is...
The show about nothing.
And everything.
At the same time.
Because we know nothing.
But talk about everything. Today we're going to talk to you about the ins and outs of healthcare.
The effects of the United States healthcare system on our country's citizens.
Evaluate whether the United States' low ranking in terms of healthcare is completely deserved.
And ask the age-old question, should healthcare be a right? Before we truly get into this, we should probably explain what is healthcare, who needs it,
Hopefully not you.
who has it,
Hopefully you.
who deserves it.
You and everybody else.
So what is it? Well, according to our close friend Merriam-Webster, healthcare is any efforts made to maintain or restore physical, mental, or emotional well-being, especially by trained and licensed professionals.
Sounds like everything anybody could ever need, right? Well, disappointingly and unsurprisingly enough, healthcare in our country, the United States, and a lot of other places in the civilized world isn't all it's cracked up to be.
While the U.S. may be ranked ahead of 154 of the established countries on our modern planet in terms of healthcare effectiveness, it is hard to look past the 36 other countries ranked ahead of the United States, especially when some of these countries can have as many as, big number,
326,733,191.
less citizens. Like the tiny European country of San Marino can have up to 214 less years of existence. Like the historic country of Germany, which wasn't officially founded until 1990, when the Berlin Wall fell and the two sides of Germany were officially reunited.
Clearly, the U.S. has had its fair share of time and a multitude of guinea pigs to get its healthcare system together, so why haven't they?
Why are they holding back from providing the citizens under them the necessities that they know they deserve?
To properly understand and evaluate the problems within the United States healthcare system, you should first know how its healthcare system works.
The U.S. healthcare system is unique and intriguing to many other modern countries, especially those that have moved on to universal healthcare for all citizens. The U.S. has no universal healthcare coverage and only recently, in 2010, enacted the Patient Protection and Affordable Care Act, coined Obamacare, in an attempt to form a healthcare system that could potentially cover all Americans, from the lowest to highest of social and economic classes. In fact, it is still in effect today, but has been seriously strained and weakened due to Donald Trump's harsh regime and, to be frank, one that seems to have a tendency to make every single attempt possible to erase anything and everything Barack Obama left behind when he left office.
Overall, the United States has a hybridized single and multi-payer health insurance system that relies on the individual to tackle the nasty and confusing world of attaining health care and insurance. Yes, health care is often covered by one's employer. However, all depends on a person having a quality job or career, and health issues certainly aren't discriminatory towards those without employer-provided health insurance and won't exclusively fall into the open and willing arms of those who do have it.
Clearly, this is a terribly flawed system which results in the United States being ranked number 37 out of 191 countries. Other main reason for this low ranking is that most of the countries ranked higher than the United States have a universal health care system such as France, Germany, the United Kingdom, and others. With the universal health care system, the federal government provides a decent amount, if not all, of the expenses for health care for all citizens no matter their ability to pay. Most of these funds for universal health care is paid through general income taxes, which is one specific gripe that a portion of the American public has with universal health care as a whole. However, this is thoroughly never mind, we'll cover that later.
So, to backtrack to a whole minute ago when we talked about a select few of the countless issues within the U.S. healthcare system, remember all of those ignominious issues? Well, we didn't even scratch the surface of all the obstacles created by the U.S. healthcare system. However, to actually provide something positive and useful to the conversation for once, we believe that switching to a system of universal healthcare can and would seriously benefit the citizens of the United States within the realm of healthcare.
Yes, we know this sounds presumptuous and ridiculous because of all the work and resources that would need to be allocated for such a massive national change. However, when you look at the pros and cons of this, the positives seriously overshadow the negatives. I mean, just hear us out.
The first and most devastating thing that comes with healthcare is the cost. Money, of course, isn't everything, except for when it is. The United States government spends a huge amount for healthcare. per person than almost every other country on this planet with a universal healthcare system.
According to a research paper from the Lancet, the United States spends just about $9,237 per person annually. The premiums for an individual cost per month is $321, while the premiums for families are almost $833 per month. Furthermore, the average deductible for a family plan is $7,983. These costs are extreme, and the average family has so many other expenses that need to be paid to keep their homes.
When things happen that are not expected, like one of your children getting cancer, for example, causing you to have to take off work, which causes these monthly costs to be pushed and soon run into debt. This debt causes the loss of things like cars, homes, sometimes even people to lose their jobs that are the sole monetary and financial providers in their homes.
Even though you may not hear about this on a daily basis or maybe even hear about it at all, this is happening behind the curtain to your family, friends, and even your neighbors. Making a way to lower medical expenses, such as converting to a universal healthcare system, could help lower the amount of people in debt per year. The average expenditures per person in the average country with a universal healthcare system is just under $3,300. So this would seriously dull the blunt edge of that $9,237 annually.
The gripe that most people, including Rep. Paul Ryan, is that the taxes required to fund a universal healthcare system would cause spending to progressively skyrocket until it reaches explosive heights. However, this anger is seriously misplaced.
Yes, there would be a tax increase for all Americans, but this tax increase would only be around 2% of payroll tax. But any aspect of bills or taxes for private health care or insurance would be eliminated. So as you can see, going from $9,237 annually to just around 2% more in income taxes, which is obviously dependent on the individual salary, so that it could only be negatively affect the top tiers of society.
So sorry, Bill Gates and Jeff Bezos. I'm sure you millionaires and billionaires of America wouldn't mind giving up a chunk of your millions and billions for us measly American citizens.
Another major pro with universal health care is the lives it could possibly save. Having less expensive health care available for people could help get more and more people to go to hospitals when they have health issues, regardless of the financial hurdle that they face now.
Most people who have no health care at all or very poor health care are hesitant to go to the doctor or hospital, and some choose bearing it through or trying to let it ride out, rather than getting the extensive bills. Not only do about 53 million people yearly not go because of the cost, but about 50 million don't fill their prescriptions that are an absolute necessity to staying alive. This is clearly a major issue because an excessively expensive system of healthcare shouldn't dictate whether or not a person can get healthcare that they need, no matter what class you're in or your financial situation.
No one should ever feel hesitant to get help, all for fear of the cost. Having this affordable health care could save many lives, and that alone should be the biggest reason to change how it is now.
Although some would say that if anyone could get health care, it would cause the waiting list in a practice or hospital to become much longer, even though it would eventually die down, at first it could cause problems because of the surplus of patients overflowing the medical buildings. Patients with more serious conditions could be ignored due to the other patients with less serious conditions being seen first, because it's so easy for them to get medical attention now. For example, someone with flu symptoms could be seen before someone with a failing liver because of how long the wait is.
The demand for services would skyrocket, bringing more jobs, which would be a positive. The more services available, the more patients that can be seen, and the less epidemics that would occur. Eventually, enough new medical centers or medical positions would be created, and it would reach an equilibrium, which would likely reduce the wait times back to what they currently are, or potentially make them even shorter.
Yeah, I don't think you have to be a genius to agree that making a change that'll save lives is a great idea.
The final pro we will highlight is on the opposite end of the spectrum as far as people's decisions in dealing with healthcare. Rather than those that bear through the onus, this focuses on the people that choose to pay the price, which results in, according to a few different studies, anywhere from 270,067 to 1 million medical bankruptcies in the United States every year.
Those who choose to pay are part of the 60% that even with healthcare have medical bill problems. They are barely making it by and making ends meet. They are unable to pay for the most basic necessities like food, heat, electricity, and just all of the household things that are necessary to make it day by day, just because of some dumb illness or injury combined with a ridiculous healthcare system that took funds from the family.
Think of it this way. In 2009, there were 306,800,000 people living in America. Of this 306.8 million, 1,400,000 went bankrupt. Of this 1.4 million bankruptcies, 877,372 were rooted in medical bills. And this was all the way back in 2009, so these numbers have likely risen unimaginably since that time 9 years ago.
Clearly, there is an issue with a very large amount of the population is going bankrupt every year because of a solvable issue. If we switched to a healthcare system that was more affordable for the general public, the average American family could then live comfortably without the constant imminent fear that a health complication could destroy their lives in more ways than one. You can clearly see, bright as day, that treating healthcare as a human right would have plenty of benefits. Far too many to name in a short video, in fact.
If the lives saved, families stabilized, and jobs created aren't enough for you, America, think of all that money it would save.
Healthcare is already a right in 30 countries across the earth, and we have seen how it has seriously benefited them.
We'll finish with this one simple statement. If you want to put our people at the forefront of political importance, then this is a no-brainer for the American government.
Okay, I think that was healthcare.
Bye.
And now, look at our sponsors and annotations.
Ready? One.
Hello.
Hello.
This episode.
I think this is healthcare.
Talk again.
Properly understand and evaluate the problems within the United States. Problems within the United States. Properly understand and evaluate the problems within the United
So, to backtrack to a whole minute ago when we talked about the select few of the countries within the... Oh, that's not countries. So, backtrack to a whole minute ago when we talked about a select few of the countless issues within the U.S. healthcare system. Remember... So, to backtrack to a whole minute ago when we talked about a select few of the countless issues... Maggie! You can't hear Maggie?
Oh, frick no!
Go back up, Erica.
Go back up, boo.
Erica, are you live?
Erica, you dead, man?
Okay.
V. Boo. That's gonna be. Why? Why? Why did
I hit my elbow. My broken one.
that relies on the individual to tackle? No, I said the individual.
Here.
Certainly aren't discriminatory. Oh my gosh! Wow. Okay. Neither. 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 An either.
Another.
An either. An either.
Another.
Okay. Another. Okay.
Are we doing it as soon as I finish saying this episode again?
Yeah.
Yeah.
This episode. Wait. Margaret? No drumming, but okay.
Okay, go to the end.
Go to the very end.
Come
on, good.
I think I got it.
I'll play the guitar. What are you gonna do? You just gonna stand in the background?
Do it
Triangle. The triangle.
Do it for the vibe.
Ding.
I ain't gonna do it. Do it for the vibe. I ain't gonna do it. Do it for the vibe. I ain't gonna do it.
Do it. Do it. Do it. Do it. Okay.
Oh, I broke it. Whoopsies.
He broke his mic.
Sorry.
He broke his mic.
Okay. Yep. Wait. Oh, sis, I look so good.
Oh no, I broke it.
Sounds similar to what I just said.
The first and most devastating. Are you
That
kidding me?
feels so good. I'm not joking. Like, I am so relieved.
Who's spilling the tea? V's spilling the tea.
Top tiers of society.
So sorry, Bill Gates and Jeff.
Empty mug. Okay. The final pro we will highlight is on the opposite end of the spectrum as far.
I was making the ugliest face before. American family could then live comfortably without the constant imminent fear that a health complication could destroy their lives in more ways than one.
Good? That was fun.
Yeah!
What? No, B, you're not gonna start. Oh my god! That's not gonna make the final cut.